Hello, another edition of Kborkrn.com, Laugh and Learn. Today we're going to be understanding continuous bladder irrigation. I have a prompt here, so I just want to play with this. One of the first things we need to do is have a doctor's order. Always a doctor's order. After that, we need a patient. We either have a male or female patient. Just because it's CBI does not mean it's just strictly male. Women can also have bladder dysfunction, bladder tumors, bladder bleeding, so it is not exclusive to just males. Mostly we see males, but females may also be getting continuous bladder irrigation. Okay, the next thing we're going to be needing are the items. What items are we going to be needing here? Well, I got a list of them here for you. We are going to need a 26 French catheter with the balloon. It is a three-way catheter at top. You see this. You got an irrigation port right in the middle. You've got a balloon port, which will say on there, remember, we always look at that top piece, that little piece right there. It always will tell us our French size and our balloon size. We do need a 30cc syringe or balloon for that, and this is the part that goes to the drainage bag, which hangs on the side of the bed. The reason we do need the 30cc ml balloon is because we want to fill the bladder up as much as possible to cause pressure to try to stop the bleeding. Be it from, like in males, it may be from a TURP, it may be bladder tumors, it may be bladder polyps. We're not really sure, but we're going to cause pressure inside the bladder. This is the part that will instill the water, and it goes around and then it comes out the port that goes to the drainage bag. Other items we may need, we're going to need a 3000cc or ml normal saline bag. It's irrigation fluid. We'll need a dual port irrigation tubing. So you can always have a bag on hand up there, so you're not going to have to wait and add one when the bag goes empty. You don't want to instill air into the bladder for any reason. And as I said, this is the catheter. The catheter itself has a 30cc balloon down here. It's quite large. Remember how it fills the bladder. This is the part where we see that it's a 26 French 30cc balloon. This is the irrigation port. This is to the drainage bag. Next, we're going to be needing normal saline right here, because the normal saline is going to be what we do for hand irrigation if we need to. If there's too many clots in the tubing, we're going to have to hand instill, of which then we need the piston syringe. It's a 60 ml piston syringe. We're going to always need gloves, and we're going to need a drainage bag for the fluid to go in. Now we're going to calculate our intake and output with this. It's fairly easy, okay? Irrigation fluid goes down into the bladder. The tube itself, the three-way, will take the bladder drainage to the drainage bag. So basically what it is, it's milliliters in, milliliters out. And guess what we do with that? Milliliters in, milliliters out. One minus the other will give us a urine output. It may be anywhere from 100 to 200 to hardly anything, but we want to make sure that the fluid that goes in comes out, because we can sort of explode the balloon. They may have problems with pelvic pain, lower pelvic pain, flank pain. It may cause numbness and tingling in their lower pelvic area. So we always want to make sure that the milliliters in equals or greater than the milliliters out. So we have to take what solution comes in, goes to the bladder, and comes out. You can do it numerous ways. You can take your solution, mark it when you empty your bag, go from that point on. There's demarcations on the solution bag here. It goes from 3,000 down to 100. So you're going to have to pull the bag tight, and that will give you your solution. Mark it with a black magic marker, and then you will know when you empty the Foley bag, if you have 500, or let's say we'll put 600 because that's it. We had 600 cc's from our irrigation bag go in. It went into the bladder, it came out, and we have 800 in there now. We know our urine output is 200 cc's because we only put in 600. We got out 800. That gives us an excess of 200, so that would be our urine output. It is so easy. Okay, the hints, I like to keep at least 2 to 3 extra 3,000 ml bags on hand. You never want to let the bags go empty. You do not want to instill air into the bladder under any circumstance. Keep an extra drainage bag on hand just for the fact that it may clot up with blood clots. You need to keep that irrigation flowing. You do not need that bag ever to fill. I personally do not use the one with the urometer on it. It has an extra area for the clots to fill in and cause the irrigation to stop. I keep an extra bottle of normal saline on hand for hand irrigation, and I always have towels and washcloths. There's always going to be a mess somewhere when you're doing this, so do keep towels and washcloths. Towel I put underneath the drainage bag. I always seem to have leakage. And from emptying into the Foley bag into doing the INO, I use one of those big 24-hour urine containers. It's easier. You're going to have more than 1,000 out. And instead of doing 2 or 3 urinals, use a big brown jug for the 24-hour urines. I always keep washcloths on hand because they may have drainage down around their urethra, and we want to keep them clean and presentable. This has been another Kborkrn.com Laugh and Learn procedure of CBI, continuous bladder irrigation. Remember to always laugh and learn. Follow me on YouTube.